Many people face the same problems. They eat less and exercise more, but their weight refuses to drop. They spend heavily on hair treatments, but results fade. They try endless skincare routines, yet the skin remains dry and fragile. Modern medicine keeps advancing, but these everyday problems remain unresolved. Why? The answer is simple, hidden in plain sight. Not a new drug, not an expensive treatment. It is something that sits on every table every day. Salt. In the emergency room, when a patient collapses, doctors don't begin with costly medicine. They begin with an IV of 0.9% saline, water with salt. Because restoring volume and electrolytes is the foundation of life itself. Sodium is the main ion of extracellular fluid. It regulates plasma osmolality around 275 to 295 mosm per kilogram. Water always follows sodium, too little sodium, and cells swell. At the cellular level, the sodium-potassium pump is the tiny engine that drives nerve impulses, muscle contraction, and nutrient transport. Salt is not just flavor, it is a life tool. Restricting salt too much can quietly disrupt health. Chronic fatigue, reduced blood volume means less oxygen and nutrient delivery. Digestive problems. Low salt weakens stomach acid, impairing protein digestion. Hormonal imbalance. Sodium loss can overstimulate aldosterone, disturbing other hormones. Low blood pressure and dizziness. Too little salt drives hypotension and fainting. Weakened immunity. Sodium plays a role in immune cell activity. Mental health decline. Chronic hyponatremia can cause brain fog, poor focus, anxiety, even cognitive decline. A diet too low in salt doesn't heal, it harms. When salt is cut too far, and water intake is pushed too high, the result can be hyponatremia. It is seen in endurance athletes who overhydrate with plain water, headache, nausea, confusion, even seizures in severe cases. The same imbalance can quietly occur in daily life through extreme low-salt diets combined with excess fluid intake. We have been taught one message for decades: salt causes high blood pressure. But this is only half the truth. Refined, processed salt in excess is harmful. Yet natural, mineral-rich salts are essential for health. The real issue is not salt itself, but which salt and how it is consumed. Why has this truth remained hidden? Because fear of salt has been profitable. Low-sodium products sell at higher prices. Refined salt, stripped of minerals, is cheaper to mass-produce. The simple slogan, "Cut salt to save your life," has fueled entire markets of supplements and substitutes. If people understood the real value of balanced salt, whole industries would lose revenue. And so, the myth has been repeated, again and again. When salt is restored, in the right form and in the right amount, the benefits are striking. Metabolism. Cells retain water and generate energy more efficiently, helping natural weight regulation without yo-yo diets. Skin. Hydrated from within. Skin glows naturally under any light. Hair. Improved circulation delivers nutrients to the roots, strengthening hair. Vitality. Mornings feel refreshed, energy lasts through the day, focus becomes sharper. Mental balance. Electrolytes stabilize mood and cognitive function. Balanced salt does not just prevent harm, it restores life. Salt is not an enemy, but it is not a miracle cure either. It is a lever. Too much tips the body into disease. Too little leaves it weak and unstable. The answer is balance. Natural salt in moderation, used wisely in daily life. This simple, overlooked mineral is one of the surest keys to restoring health and vitality.